All right, member request to do an update on Bluebird. No problem. They just got another approval, so second one this year, actually recently. This one's they're branding Skysona, formerly Eli or Elicell. I think it's Ellie. This one's for cerebral adrenoleukodystrophy, also known as CALD. And then they have the other one, which is Zynteglo. That's for beta thal. Both of them gene therapies. So essentially, we're looking for functional cures. $3 million, I think, for Skysona, which is the one that was just approved. And then Zynteglo, I think they're going about 2.8. I don't know if that's flat, but that's the numbers I remember reading. Obviously, big price tags, but again, we're going towards functional cures here. So they get these, it's over and done with. I don't know how long, hopefully we're looking at maybe an issue of having to get another therapy in 20 years or 30 years or something. I'm just saying. Well, hopefully these things hold up. There's some durability over the next couple, few decades, and then at that point maybe there's something better to look forward to. But point being is that Bluebird and gene therapies, I guess as the industry as a whole, these are big events, FDA-approved. Sarepta with their DMD therapies, they've been doing pretty well. With these two now being approved, this is it's a deep, a sigh of relief for a lot of people, both patients, providers, and I think healthcare as a whole, that maybe we might be looking towards curing some of these absolutely terrible diseases that these kids are born with, and they'll be lucky if they make it out of being a kid. They make it to adulthood, and if they do, it's just constantly in and out of the hospital. Especially CALD, it's neurodegenerative. I hate to say it's just a terminal illness, but at this point, I think the only thing they got right now is stem cell, and it's got to be I think HLA match donors, and then they got the treatments to get it done, and then making sure they don't get graft versus host disease, which could be a deadly situation. So even the treatments that exist now are not good. They're not great. They work to a certain extent, but then they're dangerous in themselves. So anyway, let's get on to Bluebird. Let's talk about the technicals first, and then we'll talk about the approval real quick, what it means, and we'll come back and come up with a game plan, or at least review it. So after several years, keep in mind this stock used to be over $100. I traded it a long time ago. It got pushed up to crazy heights because they were doing CAR T-cell therapies. Now then they spun that off. That's under TVST now, that ticker. So they were left with the gene therapies, Bluebird. So that's kind of killed the share price. Other companies kind of, gene therapies, I'll get into that too. Let's do that real quick. Gene therapies, although, we have some like CRISPR, and you got Editas, and then, that was an Intellia. There's plenty of, you got Rocket Pharmaceuticals, Sarepta, all these gene therapies. Some of these are doing really great, but there's been an issue with the fact that these gene therapies are going to be a huge price tag. It is. You can probably just imagine some of the issues with a gene therapy or gene editing. High risk to a certain extent. You're trying to disrupt how the body works, or how it's. I shouldn't say disrupt, but you're trying to correct how the body should be working normally, but it doesn't want to, so the body's going to want to reject it. It's got its own game plan, even though it's not good. it's got a game plan, and it's going to want to follow that. It's going to fight back, and in order for it to do that, gene editing is not a very passive thing. So, in terms of the interactions that we're asking for, what's happening inside the body at the cellular level, so there's some risks to be there. So that being said, big price tag, questions on durability, safety, long-term efficacy, stuff like that. And there's also the price tag issue is, I hate to say, probably the biggest problem, because obviously not everybody who has a son or daughter with some of these conditions can afford to write a check for $3 million. So then it goes to payers, right? So managed care, how these health insurance companies are going to, support this, reimburse, because this is a process. This isn't just a pill. So it's expensive too. It's not $3 million for, just cashing in on profit. It's not a pill. You are going in there and you are, well, I shouldn't, they're not, they're doing, these infusion injections, trying to get treating the body to prepare for it. There's things you need to do. This is in hospital. This is a very expensive thing to be done. And yeah, it's a cell therapy. I mean, it's a gene therapy. It's a lab experience here. So these insurance companies are looking at, should we just tell them, hey, you guys just got to keep taking, whatever. Well, I'll do gene therapies in general. We'll go to DMD because that one's probably got the most, the largest variety of alternatives for compared to getting gene therapies. Those guys are getting steroids and a variety of other drugs to keep them ambulatory and upright and moving. And DMD, you can, I shouldn't say, you can live a decent life for a while, and then obviously it deteriorates. And then I think in the 20s is really when things get grim, if you're lucky. So you're going to see an insurance company say, well, they can just take pretty generic steroids to keep them alive as long as possible, and they pass away, and it cost us this much to keep this person alive for as long as they could. And it wasn't that expensive. Now, does a multi-million-dollar therapy we're going to be paying, and yeah, the person lives longer, but how much does it hurt our pocket, right? So that's the same thing here, which is we're asking them to start picking up the bill on something that maybe they don't really want to. But yeah, the patient lives longer, but it hurts their pocket because it's $3 million. So we've yet to see how these guys are really going to get reimbursed and supported by payers for these therapies. So that's the big problem, right? Next, let's actually go to Bluebird's press release I was looking at earlier. Take a look at this. This actually does a really great job of talking about CALD. Makes you realize how important this is. Yeah, that's actually, this is basically what it's about. So that's the other thing, is that this is also being that these guys basically have to do follow-ups. They call it confirmatory long-term clinical data, meaning this is not just on the market and it's like, yep, you guys are good, go. No, these guys are going to have, Bluebird's going to have to basically update the FDA regularly on how this is going. They still have some they have at least one trial going. 15 years. Oh, man. So long-term follow-up studies. So just to make sure that things are going well. So we're gonna get. So we got Boston and Philly Children's Hospital. Essentially the best of the best. 3 million flat looks like. So now they have the pediatric priority review voucher. And I believe they got the other one. So they have 2 of them now. That's going to bring us to the next point, which is probably where you're going to hear a lot of shorts be like, oh, they don't have money. Oh, they don't have, you know, they're going to have to do an offering. All right, let's get to the financials here real quick. Man, my internet's loading slow. This is as of last quarter. This is annual. Let's go quarterly. Getting this from Seeking Alpha. So that's June. I mean, they're chipping away. They're going to need cash. The good thing is they're not. This is not going to require a massive commercial infrastructure. They're going to need to obviously handle the actual therapies, but you don't need to go to every pediatrician office with a sales force trying to get people to convince, I shouldn't say the general public, but maybe that's the best way to say it, that their kid needs to get gene therapy. These parents are well aware of that have these genetic disorders that are mostly rare, right? So they're going to a specialist. And they're probably, if they're in the Northeast, they're probably going to Boston's Children's, or they're probably going to Philly in the first place. So the doctors there are well aware. And I will tell you, I know a few people with some rare diseases. They're parents of children with these, not these specific, but others. They are well aware of every gene therapy, anything to get their children, as healthy as possible. Everything. I mean, they're studying everything from the FDA. They're well aware of these companies and what they're doing, and the risks involved. I know somebody with, their kid has DMD. They're watching Sarepta, intently. And I don't know if I don't know if they've done anything with it yet, but, they were very much, what should I say? They were monitoring and considering doing that gene therapy for their child. I'm assuming most people with CALD and beta thalassemia are aware of these gene therapies that are now available and are considering that for their children, because hey, some of these things, it's like, well, something might be better coming along in the next 3, 4, 5 years. These kids don't have 3 months to wait, essentially. I mean, you can argue that to a certain extent, but it's degenerative. So the longer they have these, the worse it gets. It's hurting the body. It's not like, oh, everything will be fine and hunky-dory once. No, it's the longer you wait, the worse things are going to get, the more damage. I mean, even if you can get the gene therapy, that doesn't mean, it's like, wipe the slate clean. So they need to, there's some pressing, they're pressed for time in many ways. It's like, the longer you wait, the worse it's going to get. So I don't think there's going to be this massive issue of, is there going to be demand? I don't know how many they can bang out in terms of these therapies, how quickly they can do them, what's the capacity. But, let's take a look at the fact that they have these two pediatric vouchers. They could sell those. Let's go to their... Sorry, I'm all over the board. This is not all of them. Read more. Oh, no. Come on, guys. What is your just press releases? This is the best they got. Okay. Let's see what the cash position. We'll talk about that in a second. So the full year is expected to be 340. They have 218, so they're halfway through. Assuming that there's going to be some increased cash burn towards the end of the year, it's going to be tight. They need to sell those priority vouchers. Yeah, here we go. So I think they need to consider that. I think that they are. They wouldn't put it into their press release to say that they're looking into it if they weren't really. Not for like the sake of an SEC issue, but that's kind of promoting the fact that we're looking to get rid of these things for some decent cash. I have no idea. Actually, I should probably look into that. What's the precedent on how much those are worth, really? I'm sure the market for that is, it's obviously worth something. I just don't know how much. Some manufacturing costs. So I think they're moving out. They moved out of Boston now. I think they're out of Cambridge, so they're here. So they did that. They reduced headcount. I think they're down like 30% in terms of expenses earlier in the year. So they're doing their best to slim things down. Let's go to, again, I'm sorry I'm all over the place here, but it's kind of going to have to do some back and forth here. Because as I think I come up with another... This one, I don't know. This one might be an issue. Because you got sickle cell, and they might not be the first nor the best. We got to see how that goes. Those clinical holds, which it seems just about every clinical, gene therapy or gene editing program is being put on clinical hold and that makes sense. I mean, we got the FDA sometimes can't just let these things just, oh yeah, it's good, everything's great, and something goes a little bit wrong. They need to get on it. I think that's understandable. So everything's back. I think everything's up and running for now, but gosh, I hate when I see some companies get like 4 or 5 of them. Turns out to be nothing. I know I should say nothing, but they release it eventually, and some companies just, maybe because it is a little bit better, just seems like they just never get a clinical hold. And it's like, is that helping somebody out there, or? But anyway, gene therapies. That's one of the problems with this is, you put a couple holds on a few of these programs, and the former market leader, potentially first on the market, they get slowed down. Sometimes it seems like a year, and that gives a lot of these other companies, big pharma, a chance to catch up. Looks like they're looking for something else for sickle cell disease. Let's bring it back. So what's the game plan here? I'm going to stick to the buy and sell thresholds that we have. I'm not looking to add right at the moment. I think we might have a kind of, every time we get up above 7 here, we wick pretty hard away. So I'm a little concerned if there's really an appetite to get this up above $8 right now. Now the good thing is if they do get above this, I mean, there's some chop here, but once we get above $8, $9, $10, and then above 11, look at how thinly traded this thing was. This came down quick. So there's a possibility that we go, we make a quick move. What's that going to take? Probably additional financing. These guys need cash, so that'll probably allow it to get there. Even if there's some sort of spike catalyst, it's probably going to sell off. That doesn't mean it will, but there's a high likelihood it's going to fade at least. It probably won't be a durable move. So they're going to need some cash to alleviate the fears that they're just going to dilute the market extensively, and they're not looking for non-dilutive financing, selling those vouchers, which I think that'd be great. Taking on debt, not excited about that, but maybe if they take on debt, I can't imagine it being the first thing they want to pull, because taking on a massive amount of debt and you don't know how this is going to go commercially with the launch. I mean, are they going to get reimbursed? Is there crazy demand? Are they getting these kids? How quickly can you do these gene therapies? It does come down to how much money can you guys make, because if you're going to do a debt or some sort of financing, and there's going to be tranches, and those tranches are going to be based, you get a nice big chunk for launch, and then you got to hit milestones in terms of revenue, and all these stipulations and conditions that are put in there. That could be an issue, because if things don't go well for the first year of launch or two of launch, and then they're running out of money, but they still, owe money. They still need to get this, that it becomes an issue in a couple of years where they're not hitting their commercial numbers for additional tranches, and they owe money still to pay off. Then it becomes a really big problem, because then they're going to be diluting extensively to pay off what they owe, and then they keep the lights on. So they need the commercial launch to go well. They need the reimbursements. They need to make sure that the insurance companies are on board with this, which we don't know if they are. That being said, if there is demand, these guys might only need to sell those vouchers, maybe a little bit of an offering here and there as commercial efforts, showing traction, and they're looking to expand while they're doing it, stuff like that. Then it makes sense, because then if you're showing growth, and there's other things in the pipeline that might be promising down the road, maybe we can get up and go, and we can also handle some dilution at a higher share price. So a lot of things need to go well before we really probably see this fly. So let's go with risks, insurance companies, competition. There's plenty of kids out there that probably need this. $3 million a pop, that's going to be a lot of money when it happens, when you get kids through the door. But these are rare diseases. So once you do your gene therapy and everything's good to go, that person's not coming back, or not coming back for a while at least, to get another gene therapy. So once it's over and done with, what's the next step? Are we going to Europe? Are we going to other commercial opportunities? I don't know. Now, to end this, to go back to the member's question, which is this a buyout? I didn't explain that right away. I was kind of holding back on that. Is this a buyout? I don't know. I think they need to launch it. There is somebody out there right now that knows the FDA's gonna, be very supportive on gene therapies going forward. Maybe there's some softening from insurance companies about, our gene therapy is really worth it. Maybe some big companies are looking at this. It's like, hey, these guys are going to, they produced it. The shareholders paid for all this for, essentially a decade here. Can we buy this out pretty much on the cheap and get enough shareholder approval? I think they could. There's some of these big guys still have a lot of cash. Bluebird is, they separated, they split into two companies. I believe that reasoning was either for one of them to be bought out, separate the finances. One was going to drain the other. I don't know who's. Maybe they're both seeing as that. Maybe it's more attractive as for them to be bought out separately. Or like I said, maybe it's just we think one could be bought out and the other one's, kind of the long-term play. It's a standalone. I don't know, but I think Bluebird has that potential. But I don't know if it's going to be a premium. And I don't think anybody wants to pay absolutely crazy premium price for this right now. I think they want to see how bad this is at launch or how good this is at launch. If it's a good launch, meaning after a year they're still getting people in there, they're seeing steady flows of patients, things are going great, there's patients, providers are happy, maybe Blue can get more than one suitor and demand a nice solid bio price. But if they go a year or so and it's just slow, things are commercially they're just not getting kids in there. Again, insurance companies are not doing their job of trying to make people healthy by allowing them to get things that could save their life, and they're not supporting it. Maybe they just wait and let this grind down because it's expensive company right now, and maybe they can buy it on the cheap after the a failed launch. I shouldn't say failed, lackluster launch. So that's a possibility. Anyway, the game plan is, for me personally, things are looking great. I'm not rushing to sell ahead of my sell targets here. On those, if we're getting close enough and it looks like it's just the market and the price action and the tickers not looking promising, I'll definitely book some profits. And I wouldn't even hesitate to above our sell target one there to go house money as quickly as possible. But then again, on the other side of it, like I'm after loading up at buy ones and twos, I'm happy. I don't foresee this falling apart anytime soon. Even with dilutive, if they're going to even double the amount of shares with an offering, I'm still happy with my where I bought it at. So that being said, it's kind of a hold right now. It could be a buy on a technical pullback, which I would look for. Some of these are trend lines. I'll move this one, and I'll probably get rid of this one. If I was to clean it up, let's see what we got here. This might be one right here. Yeah, so we'd probably come into, if it was today, maybe around $4.50, $5. Bottom of the Keltner channel. Yeah, so around $5 I might be considering. But we're above the anchored VWAP. The market is rough, so I don't expect to see it run above 8 anytime soon. But maybe it needs to just settle in here and just chop around, accumulate, and then, on commercial launch news or financing news, we can see a nice solid move up and then take advantage of that. All right, sorry for the long, kind of talking in circles there, but I think it needs to be addressed that this is a great moment for Bluebird, for patients, providers. Now it's a little bit of, can we get money, and how do they keep the money coming in with the commercial launch. All right, hope that was helpful, and good luck.